So, a huge announcement just came out of the White House, and it's put one of the most common medicines in the world right under a microscope. It connects this drug to one of the biggest questions in child health today: what causes autism? And as you can imagine, this has created a really difficult situation for millions of families. So, let's break down exactly what was said, what the science actually shows, and what it all really means for you.
And it all kicked off with this just wow, this massive claim straight from the president. I mean, a statement like that offers this incredible amount of hope for some people, but it's also raising some serious red flags for scientists and for doctors. So, what's the actual policy behind this pretty dramatic headline?
Okay, first things first, let's just unpack the announcement itself, what the new policy is, and who was there delivering the news.
Here is the absolute core of it. The FDA is now going to formally tell doctors that using acetaminophen while pregnant could be associated with a higher risk of autism. The official advice now is to limit its use, only taking it when it's absolutely medically necessary.
And you've got to look at who was standing up there making this announcement. I mean, this was not your standard issue press release. You have the president, the Secretary of Health and Human Services, and the heads of the FDA and the NIH. That lineup tells you this is a coordinated, top-down priority for this administration. So let's zoom in on the drug at the center of all of this. One that is, let's be honest, probably in almost every single one of our medicine cabinets. We're talking about acetaminophen. You almost certainly know it by its most famous brand name, Tylenol. But it's the main ingredient in literally hundreds of different over-the-counter products. And for decades, it has been considered the safe, go-to option for pain and fever, especially during pregnancy. So the specific advice now is for pregnant women to try to avoid it unless it's absolutely necessary. For something like a high fever that you can't just tough out. For years, decades even, the guidance was the exact opposite. So this is a huge fundamental reversal of what doctors have been telling patients for a very long time. And this, of course, brings up the biggest question of all. What is the scientific evidence that's driving this kind of massive policy shift? Well, this is where the picture starts to get really complicated. And this is where you see the central conflict, because the science is just not settled, not at all. On one hand, you have the administration pointing to a review of older studies that suggests there's an association, especially if you take the drug for a long time. But then, on the other hand, a massive study in Sweden, looking at 2.5 million kids, found no link when they compared siblings. And on top of that, a federal judge just recently threw out a bunch of lawsuits about this very thing, saying there wasn't enough credible scientific evidence. Now, as you can imagine, the company that makes Tylenol, Kenvue, they've responded, and they've responded forcefully. Their position is crystal clear. They are standing by the decades of science that have found the drug to be safe, and they argue there is just no credible evidence of a link to autism. And this, right here, is the really tough spot, the critical dilemma. Because avoiding acetaminophen isn't a risk-free choice, not by a long shot. Medical groups are quick to point out that not treating a high fever or severe pain during pregnancy has its own very serious risks, things like miscarriage or even birth defects. For a lot of doctors, acetaminophen is still the only option they recommend. But this announcement wasn't all just a warning. The administration also pointed towards a potential therapy, something they say offers new hope for actually improving autism symptoms. The drug they're talking about is called Leucovorin. It's basically a form of folate, which is a B vitamin. You might also hear it called folinic acid. It's not a new drug, but using it in this way, yeah, that's new. So Leucovorin is usually used for things like vitamin deficiencies. The autism connection is pretty new, and it's coming from some small, early trials that suggested it might help with things like verbal skills. But here's where the story gets, well, a little weird. On the very same day as the White House announcement, a notice from the FDA approving a version of this drug went up online, only to be flagged for withdrawal just hours later. It's a confusing reversal that just adds another layer of uncertainty to what the administration is calling this new hope. So to really understand the why behind this whole announcement, we need to zoom out a bit and look at the bigger picture of autism in America today. This is the number that is driving this entire conversation. The CDC estimates that 1 in 31 kids in the US is affected by autism. That is a daily reality for millions and millions of families, and it creates this incredible, totally understandable pressure to find answers and to find causes. Now, you hear a lot about how these rates are rising. So what does the scientific community have to say about that?
Well, the general consensus is that this increase is mostly because we have much greater awareness now, and we're using a much broader definition for the autism spectrum. Basically, doctors are just better at diagnosing it, and they're catching milder cases that probably would have been missed in the past.
And it's impossible to talk about this without mentioning a key figure who's really driving this policy: HHS Secretary Robert F. Kennedy Jr. He has personally made finding the cause of what he calls the autism epidemic a central mission for his department. He's launched a huge research effort and has promised to find answers. And that gives you some really important context for this whole White House focus.
And that leaves all of us with this really fundamental question. For parents, for patients, for doctors, this announcement creates an incredibly difficult dilemma. You've got a top-down government directive on one side, and on the other, you have decades of medical guidance and a body of scientific research that's far from settled. It forces a really tough conversation about how we're supposed to weigh evidence, risk, and hope when we have to make some of the most personal health decisions of all.